When you get me all the members from Global to golfing, give me the actual golf course ownership and all the employees. And then, well, I was really wanting to own some golf courses myself. 20 miles down? Yes. And somebody was putting something underneath going, oh, look at light emitting diodes. And then for all those amputees that think that I'm insensitive, I'm not. I am sensitive, but there's a certain amount of truth to the amount of pain. I think doctors could be a little too cautious when it involves pain medication. I know. You say I'm a perpetrator of crime, I'm a drug addict and drunk. But the truth of the matter is, when it really hurts, don't be a fucking dick. Because you make up bullshit to cover yourselves from any sort of liability. We have a lot of different medications in the United States, and the opiate crisis is a big fucking excuse to cause people a lot of pain and suffering that happens to be completely unnecessary. So if somebody walks in and doesn't have any limbs, don't ever tell them, well, we can't prescribe pain medication. Their bodies build up a tolerance to pain medication. In fact, the antibiotics necessary for. Don't ever shortchange any person because of your personal worry of liability. Opiate crisis. Now, you better think about each and every patient that you have. There's this big move in the medical profession that opiates are bad, but they actually are very good painkillers. And when somebody says something hurts, don't be a dick. Prescribe the pain medication. Now, if they go back month after month, oh, then you could cut them off. Pooch. They should, because you like to cause people to suffer. Now, I've noticed that the medical community is all caught up in this problem of prescribing pain medication that actually removes pain from a person's body. It's very popular to say that everybody's going to be an addict, but the truth of the matter is, very few, well, let's look at it. Give me all the pain medication, the real opiate crisis pain, the opiates. Give me every opiate, give me the opiates. Now, what doctors are trying to cover their ass instead of actually treating their patients? Because I hadn't mentioned a multi-billion-dollar lawsuit today. Coach, a lot of these are multi-million-dollar lawsuits that could add up to some really large. But I've noticed that some, well, your opiate crisis is bullshit. You like to see people suffer. With all the technology that the United States has and the rest of the world, I know OxyContin is addictive, yes, but very few people are actually addictive. See, it's kind of like a 6% of the population really has propensity for problem drinking, and maybe 4 to 5% of them have the actual genetics to be an alcoholic. There is a, well, let's just look at the sewing of those that are prescribed. Give me every prescription of every opiate in the United States of America. Then for the last 30 years, let me just see. Why are they so important? Oh, you want us to suffer. You thought everybody's going to be an addict if we prescribe those. I've had a lot of prescriptions for penicillin and I have a lot of broken teeth. And somebody said I was a drug addict. In fact, as I remember, I've documented a lot of lawsuits. What's not funny? Snot. Why don't you get me the cum of every employee in every hospital and all the cum that had to come to find out that had to be on the individual? And then give me the use of opiates for the actual person as well as the cum of the dog. See, dogs will call,